chat box open, and I assume someone would tell me you are consenting to be, oh, okay. I'm assuming everybody can see the screen. Nobody's saying in the chat box that they can't. I'm assuming everyone can hear me, right? And we are currently recording. So yes, it looks like we're good. Okay, so what I wanted to do was go ahead and just take a moment to welcome everybody and kind of introduce you to what we're going to be talking about today. We are looking at caregivers and those that care for individuals with developmental disabilities, and what that does to mental health, and some indications for mindfulness moving forward. We are going to talk specifically about autism spectrum disorder a little bit more specifically than just general disabilities as well, although we know mental stress is impacted across different spectrums and with different disabilities, so keep that in mind as well. And then we're going to talk about some of the current research that we have on caregiver stress, and then some mindfulness, like what can we do? We want to leave you with some strategies today about what are some things you can do or look at or pass on to those who you know may be in this particular situation, and provide some strategies for support. So just as an introduction to who I am, my name is Dr. Theresa Carden, and I am an associate professor at the Chicago School of Professional Psychology. I work in the online applied behavior analysis program, and absolutely love it. In fact, one of my co-presenter here is one of my students from that program. They are a stellar group of students, and I really enjoy working with them. I am both a board certified behavior analyst at the doctoral level and also a speech language pathologist. So I'm very interested in collaboration and working across disciplines, particularly in public health sectors, and how that works. So when the opportunity came to present at this conference, I was really excited because it really is right up my alley of we all have to be working and doing this together to support families. So those are some disclosures. If anyone's interested about the types of things I've been involved in, different publishers, different universities, those types of things. We can talk more about those if you have questions, but I'm assuming we're all good. So I want to turn the time over to Alyssa to let her introduce herself briefly.
Hi everyone, my name's Alyssa Bates. I am a board certified behavior analyst as well. Like Dr. Cardon said, I'm a PhD student with the Chicago School online program in applied behavior analysis. I work right now in an inpatient psychiatric hospital in Pennsylvania. So we actually service individuals across the lifespan with autism spectrum disorder and other developmental disabilities as well. Many of the patients that I get come to us on an acute basis for stabilization purposes, and the majority of them do present with pretty intense, severe, aggressive behaviors. And they typically have a mental health diagnosis as well. Mindfulness has made a very big impact in my personal life as well as my professional life. It's something that I have great interest in, the relation to the field of applied behavior analysis, and it's something that I really try to work with my staff and my job on as well.
Thanks, Alyssa. Okay, so as I mentioned, we are going to focus some of this presentation on autism-specific research, but that being said, we want to give you an introduction into autism for those of you who may not be familiar with it. But please know that we do recognize that caregivers supporting individuals with a variety of disabilities experience heightened stress, particularly now, given what's happening across the world. But we want to focus on mindfulness support in general, so keep that in mind. But in terms of what is an autism spectrum disorder, this is one definition. It is a developmental disorder that's characterized by difficulties in communications and social relations, often referred to as social communication, and the presence of atypical behaviors, such as repetitive restrictive behaviors, insistence on sameness or insistence on routines, things like that. In terms of official diagnostic criteria, the DSM-5 talks about different levels of severity. So one of the things, and Alyssa, you can clarify this more too as you start to talk about the types of clients that you serve. But one of the things that happens is we all of a sudden had definitions changed in 2013 to talk about the diagnosis of autism in terms of what I mentioned, the social communication disorder piece, and then the presence of those atypical repetitive behaviors. But at the same time, the definition changed to talk about levels of support that are required. So a level 1 client, sometimes people refer to those to what we used to use the term Asperger's or high functioning autism to refer to, would be requiring support. So what exactly does that look like? Kind of depends on the day and the week and the moment for that individual, and it can change over time. Sometimes they may require more support than others in heightened stress, but in general they require support, but they're not as intensive. And so you can see there on that slide kind of what that is defined as. And then a level 2 would be requiring substantial support. And again, that word substantial is really the only difference. So I kind of find it interesting, like, how are we defining the word substantial? What does that mean? But it definitely involves more impairment with social communication and the presence of those repetitive behaviors that start to really get in the way of daily functioning and being able to participate in their environment more. And then a level 3, which sometimes people also refer to as severe autism. And I put that in quotes because those aren't my favorite terms. I feel like I've worked with many individuals and many families over a long time, and literally the day and the moment and the interactions can change based on what's happening. So while someone may be considered very high functioning in one environment and during one interaction, that could change significantly given different parameters for the same individual. So it's not a fixed type of interaction necessarily that's always positive or always a real struggle. So keep that in mind. But those level 3 would be considered requiring more support. Often they have severe deficits in verbal communication. They may be considered non-verbal or non-vocal. They may communicate in non-standard ways or require significant support to communicate. And then they have those preoccupations, those repetitive behaviors where they struggle to kind of break out of some of those behaviors. And if those repetitive interests or behaviors are disrupted, that can be very challenging to the individual in order for them to continue to engage with others in their environment or to continue to remain regulated. So those are some of the concerns there. But that's the official DSM-5. This is actually my favorite definition of autism in particular. Always unique, totally interesting, and sometimes mysterious. So I think that, I don't know, it's a pretty famous saying. I believe it was Stephen Shore that said it originally. And he's a person with autism. And he said, if you've met one person with autism, you've met one person with autism. And that has been really true in my experience. And I feel like that's very similar across disabilities. So often we talk about different disabilities and people's experience, and yet caregivers experience a disability in very similar ways, often in terms of the amount of support and stress that they're experiencing. So a few facts and figures on autism specifically. There are over 2 million cases of autism in the United States. A new case is diagnosed approximately every 20 minutes. I actually can't remember where I heard that statistic, but I thought it was interesting. 1 in 54. Last week, the numbers changed again. It was 1 in 58 up until last week. But now the new data is coming out that suggests 1 in 54 children are currently being diagnosed with an autism spectrum disorder. 20 years ago, the numbers were about 1 in 10,000. So just keep that in mind. Some of that is due to different ways that we have to diagnose. Most of that is due to increases. Not all of it, but most of it is. So boys are 5 times more likely than girls to be diagnosed with autism. And the Journal of Pediatrics suggests that it's very expensive to care for an individual with autism. So when we talk about caregiver stress, we're definitely talking about the financial side of it as well. And I know Alyssa will get into more detail with this, but we often have families who were 2-income earner families who go down to 1-income earner family. And typically it is the mother that stays home to help kind of become the case manager for their child in terms of their therapy, driving them around or organizing the therapists that come into their home, one or the other. So those are some of the facts associated with autism currently. And so how does this impact caregivers? And I'm going to let Alyssa take over, but I want to just kind of highlight before I turn the time over to Alyssa that we're all experiencing heightened levels of stress right now in the current pandemic, and just the changes to routine, and everybody's kind of, okay, what is this new normal like? So for just a brief moment, put yourself in the shoes, if you can, close your eyes if that helps you, but put yourself in the shoes of a family who happen to have a child with a disability, be it autism or something else. They're not only expected to continue working from home, if that's even possible, if they're even able to continue making an income, working from home, homeschool any children that they happen to have at home, and help those children manage their now disrupted routine. Maybe they have sick family members or family members who may require some extra care in various ways, grocery shopping now with all of our social distancing requirements put in place, and on and on and on. These people are now also being asked to provide round-the-clock care for a child with special needs whose lives and routines have been completely disrupted. So, I mean, imagine these are individuals who were attending school or who were going to clinics and receiving medically necessary care, if it's applied behavior analysis, or receiving educational care within the school settings, depending on what it is. But it goes without saying that there are going to be new levels of stress and impact that come to light when this pandemic is under control, if that's something that happens, or however this pans out. And obviously we don't know that yet. So I just have some heightened awareness right now around how many of our clients are struggling, and what we're seeing. I have students every day trying to manage helping families, given these new times and the unprecedented nature of what's happening. So just want to keep that in mind, because this impact that we're talking about is even elevated right now. So Alyssa, I'm going to go ahead and turn the time over to you, and I will forward slides as you need me to.
Thank you. All right, we go on to the next slide. Thank you very much. So I've got a lot of literature that I'm going to review with you today, but kind of in essence, the point of all of this is, and all the literature that I'm going to review with you is that these, either they're familial or they are professional caregivers that are, taking care of folks with developmental disabilities. In particular, they typically report very high levels of stress. They report some feelings of depression. Oftentimes they report feelings of anxiety as well. Many times they're reporting burnout in either their work or in just their day-to-day lives and caring for their loved ones who have developmental disabilities. And they're also reporting an overall poor psychological well-being. So looking into mindfulness and, what mindfulness means, we could do an entire presentation on just mindfulness, or multiple presentations on mindfulness. However, to put it simply, mindfulness can mean having an awareness to one's experiences, fully accepting these experiences without judgment, and focusing on one feature of that experience at a time. Mindfulness can also be noted as a means of developing new methods of control to use in our everyday lives in those really high stress situations, or in any situation really. Mindfulness has been noted to create positive change in our lives if we practice it consistently. Mindfulness has also been used to train caregivers of developmental disabilities to target stress reduction, and it has also been used to help reduce the symptoms of anxiety, obsessive thoughts, and increasing the use of coping skills in these caregivers, as well as training the individuals with developmental disabilities to kind of use mindfulness to decrease these symptoms as well. Mindfulness a lot of times can be said as, just be, or just being in the present moment. We're not focusing on the future. We're not focusing on the past. We're being totally in tune with our senses in the present moment. We're also becoming more aware of where we are and what we're doing now, without becoming overly reactive or overwhelmed by what's going on around you. So I think on paper, mindfulness sounds really simple, but if you've ever practiced mindfulness for any length of time, it's often more challenging than it seems, for sure. So why mindfulness? So to start us out, The majority of the studies that I'm going to review with you today address three main components. So self-satisfaction of these caregivers, their levels of stress, and their overall quality of life. So multiple studies initially have been done to sort of, just recognize that these are issues, that the self-satisfaction of these caregivers is not, it's not great, that their levels of stress are very high, and they're not reporting a great quality of life. So many researchers have taken, self-report measures to examine these caregivers and their family functioning and how these levels of stress are impacting their functioning as a family or just their quality of life. Results typically are showing that the caregivers who were displaying avoidant behaviors, they're rating themselves as having pretty poor mental health. And they're also the same caregivers who sort of believe that their stress is totally situational and that they have no control over the stress that they're experiencing. So, from what I just reviewed a little bit about mindfulness, is that mindfulness can actually help us develop a sense of control in our situations, which if we can respond to high stress situations in a controlled way, in a more regulated way, we can reduce those feelings of stress. So in particular, Whitehead and colleagues in 2015 designed a study, you can leave it out here, designed a study that involved the primary caregivers of children that were diagnosed with autism. They were 18 years and younger. So, this study really was supplemental to the current understanding of the mental health needs of caregivers in this area, and it gave implications for a method to make improvements in their mental health by intervening in some way. And so when you're looking at having avoidant or really maladaptive behaviors when we're feeling stress and anxiety, mindfulness has been shown to help in these areas. There's research out there that has even shown that parents who have young children who don't quite have a diagnosis of autism yet, but they're suspected to have autism or some kind of developmental disability, that even before the diagnosis is there, they're already reporting very high levels of stress and experiencing more feelings of anxiety than families with neurotypical or suspected neurotypical children. Looking further into some research specifically by Niklicek and Quichbers in 2008, they actually set out to determine the mediating effects of mindfulness when using a mindfulness-based stress reduction program. They took 40 women and 20 men from a community setting that were serving the developmental disability population. The caregivers here were reporting, the symptoms of distress, and they were randomly assigned to two different experimental groups. One group was the MBSR group, the mindfulness-based stress reduction. The other group was the control group, or the waiting list. So pre and post-test questionnaires were given out, which assessed the participant psychological well-being, their quality of life, their levels of stress, these 3 points that we have here. After intervention, after the group that practiced the mindfulness-based stress reduction program, they reported significant reductions in their perceived stress and their vital exhaustion that they were experiencing. They noted that they were able to maintain a positive affect in really high stress situations, and that they had noticeable improvements in their overall reported quality of life. So, this study in particular helped demonstrate that mindfulness alone might be able to bring apart some of those positive effects that are observed in a mindfulness-based program. Similarly, Neville and Haberkamp in 2018, they surveyed 97 direct care staff who were working with aggressive adults with developmental disabilities. They were attempting to determine the staff's level of mindfulness coping styles in relation to their resilience or burnout in their jobs. So, this is very relative to the work that I do. In my current work, I have 85 staff who work in very, very high stress situations. They help intervene with, very intense, severe, aggressive behaviors at times. And, having mindfulness-based techniques to use in those moments where you can kind of be very present, very aware, really, and even from my observations, can make an impact in how you're responding. That doesn't only impact, you and your stress, but your coworkers or the clients that you're working with. But in this study in particular, mindfulness practices turned out to be the sole predictor of job retention for these folks. Which is, pretty incredible when you look at it that way. The results showed that those who were using those mindfulness skills, they were giving very non-judgmental descriptions, and they were actually observing their environment as a coping skill. They were the ones that outlasted burnout. They were the ones that were very resilient in their job. While those on the opposite end who were engaging in a lot of avoidant, maladaptive behaviors and coping skills, they possessed many more risks for burnout in their jobs. So that's just some, some data that tells us that this is important, that we hear you. We understand that as caregivers, really, in this field in general, but that as caregivers for, folks with developmental disabilities, that we hear you. We see that the need is out there for some support for you and for some training. So, research has moved in that direction to say, okay, hey, mindfulness seems to be working. Why don't we take it a step further and actually use mindfulness as an intervention? So, based on the literature, some suggestions for supporting families. And like Dr. Cardon noted, you meet one person with autism, you've met one person with autism. So it's not to say this is one size fits all, but the literature is out there. So to start us off, Singh et al. 2006, and I will review a few articles by Singh and his colleagues. This is an area of his competence and continued research for the last, more than a decade. So there's a lot out there. It's not that I'm necessarily biased, it's just that he has a lot of research to offer in this area. But anyways, in 2006, he actually studied the effects of mindful parenting techniques. So, this first group we have here, mindful parenting techniques. The goal here was to increase self-reported stress, so to improve self-reported stress, and parenting skill efficacy in parents of children with autism spectrum disorder. So following this mindfulness-based training, parents actually reported an increase in their parenting skills and an increase in the positive interactions that they were having with their children. In addition, and something that I find just so fascinating about mindfulness practices in general, is that indirectly in this study, the parents noted a decrease in the rates of their children's noncompliance, a rate of their self-injurious behaviors, and a decrease in the rate of aggression. So when you're studying mindfulness, this term can sometimes be coined as a spillover effect. Essentially, those who are practicing mindfulness begin to notice changes in other aspects of their life or other people in their lives. So while the researchers weren't directly focused on, teaching mindfulness to decrease these things, they were actually teaching mindfulness to increase, parents' efficacy in their parenting skills and the positive interactions they were having with their children. But because of the spillover, it's really cool. They actually saw a decrease in these pretty problematic behaviors. Similarly, we saw it in 2007, Singh also offers some great research, which then directly investigated the effects that mindfulness training for parents would have on their child's maladaptive behaviors and interactions with their siblings. So the goals here were more so to actually target those maladaptive behaviors. So researchers also took a look at parental self-reports on, their levels of stress, their parenting skill satisfaction, and then those interactions that they were having with their children. So they took 4 mother-child dyads. They were participated in the study for 52 weeks. So I mentioned earlier that mindfulness is, effective when it is practiced consistently. So I find a lot of validity in the study that it was done for 52 weeks, which is, essentially a year. So it really goes to, show that the consistent effects of mindfulness. But the mothers, they were taught to use some mindful parenting techniques and ultimately saw a significant decrease in the child's aggressive behaviors, a decrease in their negative interactions they were having with their siblings, and an increase in their parenting satisfaction. So again, a lot of the similar results that we saw before. Taking a look into parents who have children that engage in rather severe and intense physically aggressive behavior. So this is more of the population that I work with on a day-to-day basis. Mindful parenting has shown to be effective in reducing this stress that's surrounding these really intense behaviors. So in 2013, Beer and colleagues studied parents who were using higher levels of mindfulness parenting versus those who were using more traditional parenting methods. So this actually showed those who were using higher levels of mindfulness practices were showing lower levels of depressive symptoms and stress. Interestingly, though, in this study, there was no correlation noted between the mindful parenting and the symptoms of anxiety. However, the parents started to disclose that more depressive symptoms were noted, were related to having children who had more severe problem behaviors. And then the parents, again, disclosed that they were not using mindful parenting as much as they recognized that they could have been. So the lack of mindful parenting, resulted in more depressive symptoms. And understanding that these parents, or any of us in general, we typically, if we're not practicing this, we're not regulating our emotional response as well, especially when we're in really high stress situations. So this is where mindfulness, again, can really come into play and has, some known positive outcomes in this area. In this particular study, it was interesting. It mentioned that if the parents were to kind of increase their awareness in the present moment, even when they're dealing with really intense behaviors, that they may be more capable to gain control in that moment and regulate their emotional responses. So using a mindfulness-based stress reduction program, or MBSR, Llewellyn and Nice in 2015, they developed a work group for family members. It was titled Coping with Stress, a mindfulness group for families of teens or adults with developmental disabilities. So this program was actually used as an attempt to improve parental stress levels. In this case, their common struggles stemmed from their aggressive children who all had developmental disabilities. So following intervention, this work group reported significantly lower levels of stress amongst many other benefits that included more positive child-parent interactions. They felt like they were provided with an advanced approach when dealing with really difficult situations with their children. And they had a new set of skills they learned from the mindfulness group. And then looking into mindfulness-based positive behavior support programs, or MBPBS, I'll probably refer to that from now on. Most recently, Singh et al. In 2019 studied the direct effects of a 3-day mindfulness-based positive behavior support program. It was a training and where they trained both the mothers and the children with developmental disabilities. Their aim here was to reduce stress levels in the mothers, which in turn showed a decrease in their child's disruptive behaviors. Again, we are seeing ample benefits to not only the caregivers that are learning these mindfulness techniques, but to those that they're serving as well. And I think that's really the driving point here, is that certainly it is helping, reduce stress levels. It's helping give a better quality of life, but it's also affecting the performance or the type of care that they're giving to their loved ones or their clients. Some suggestions for clinicians in this field, those of us that are working in a more clinical setting, where maybe it's not our loved one, but it's our profession and what we're doing in our day-to-day. So specifically, Brooker et al. In 2012 took notice that work-related stress can affect not only the individual person, but the organization as a whole. Something, again, that I feel like I experience on a day-to-day basis with in this line of work. You can see this with continued truancy, staff turnover, overwhelming workloads, for the staff. They feel like they have insufficient resources, they feel like there's a lack of support and that they're feeling under-rewarded for their efforts at work. And I'm sure that working in the mental health field in general, we have all felt that before, and we all would have appreciated some sort of intervention to use. So in this study in particular, researchers placed specific emphasis on staff that were supporting individuals with developmental disabilities. They were reporting being impacted by specifically verbal, physical, and emotional abuse that they often experience from working with their clients. So this was interesting. It was an occupational mindfulness training program, or OM, that they used, which was an adaptation to MBSR and positive psychology practices. That was used for 8 weeks, and it was used to investigate its impact on mindfulness and psychological well-being outcomes for this disability support staff. So the participants reported a positive change in their ability to manage their stress in a more appropriate manner post-intervention. So again, not those really maladaptive avoidant behaviors, but more positive, being present and controlled behaviors. But something that's really interesting about the outcomes of this study is that the staff noticed that their anxiety and that their negative emotional symptoms had actually increased. So, despite the contradictory findings, participants rated the program highly. They started to recognize that maybe this increase of these increased feelings of anxiety, these increased awareness to their stressful situations was coming because they were getting stronger in their awareness. So being more aware of their stress made them feel more anxious. And they made mention that with practicing mindfulness, being more aware of your stressors can, in a sense, evoke more anxious feelings, but continued practice can help us gain some control over our situations and respond to those feelings in a much more mindful, regulated way. So while, like I said earlier on, if you've ever practiced mindfulness, I'm sure that you have experienced that where sometimes you become so aware, you just want to turn the aware switch off. I don't want to be any more aware of my situation. But with continued practice, we can learn those, ways to have that sense of control, being very present and grounded. We see more success with mindfulness-based stress reduction programs with Bazzano et al. In 2015. Researchers used this approach to alleviate levels of stress in caretakers. The participants practiced the MBSR program for 8 weeks. Again, mindfulness was the core component of this training. There were very compelling improvements with this study in that all participants who completed the 8-week mindfulness-based program had an increase in their mindful awareness, their psychological well-being, their self-compassion, which is huge. We all should have some self-compassion, but that was increased, and they actually rated their physical health as being as improving as well. And then they rated their levels of stress as a decrease in the levels of stress as well. So this is one of my favorite studies, actually, that I'm going to review with you. But besides the psychological well-being that we've been looking at, and our overall quality of life, physical health factors, have also been used as a source of measurement when assessing the efficacy of mindfulness-based programs. So hats off to, and I hope I don't butcher this name, Ruiz Robledo in 2014 and colleagues. They conducted a 9-week mindfulness-based program to assess the changes in mood states, self-reported health, and salivary cortisol levels, which I just think is so cool, all within caregivers of people with Autism Spectrum Disorder. So this was a pilot study, but it demonstrated effects to not only that psychological well-being, but that physical health as well. So while the participants were reporting feelings of decreased anxiety, improvement in their self-perceived general well-being and their general health, there was actually a tangible, observable decrease in their cortisol levels in their saliva, which I just think, and in my field in applied behavior analysis, I feel like we could potentially better understand mindfulness-based interventions at this caliber due to those observed benefits that we're seeing. It's not just based on these self-reported measures, but there's a product, there's something that we can see, there's a true change that we're able to, really detect in the environment, which I just think is so, so cool. The last study that I'm going to review with you this evening, and it is my favorite to date, it is by Singh et al. In 2014. They developed an applied study that used a 7-day mindfulness-based positive behavior support training with direct care staff who were working in a community-based setting with residents who engaged in aggressive behaviors and carried a diagnosis of a developmental disability. So this follows suit with everything that we have reviewed before. Personal experience, I used to work in a residential setting with adolescents with developmental disabilities who often exhibited pretty challenging, intense, aggressive behaviors. And I can, just speaking to that experience and the staff that I used to supervise there, you know, they truly, you know, they are superheroes sometimes. They are taking care of these, you know, individuals the best that they can, and they really are experiencing this burnout. They really are experiencing, you know, just so many challenges on a day-to-day basis, but they really are there to make positive impacts. So in my opinion, if we can offer them something like this, that's, you know, starting to, you know, gain more momentum and potentially has these wonderful outcomes, then we should be. So anyways, back to the study. The goal of this study was to, well, there were a few goals. Number one, to reduce staff stress and turnover. So like everything else we've reviewed. Number two, they were actually trying to increase the financial savings of the employee agency. So, you know, always have to get that buy-in. If you're going to propose something, you know, you always want to have the buy-in. So if you're working with an agency and you're saying, hey, this could benefit you financially, then, you know, maybe they'd be on board with it. Number three, their goal was to decrease the use of verbal redirections and physical restraints used with the clients. And four, to reduce the number of staff and peer injuries that were caused by the aggressive labeled residents. So this study has amazing results. The MBPBS training explicitly instructed staff. So, you know, this is something that for if you're a supporting clinician or just in your day-to-day, if you'd like to practice, specifically they were instructed to use the 4 immeasurables, which are loving kindness, compassion, joy, and equanimity. So equanimity means having a mental calmness, composure, and evenness of temper, especially in difficult situations. So that's everything we've been talking about thus far. And then the 3 poisons, which are attachment, anger, and ignorance. And then some other simple meditation mechanisms that they were asked to use in their mindfulness practice every day. So when compared to baseline data, there were actually significant clinical and statistical reductions in the use of verbal redirections. There was a complete disuse of physical restraints following this intervention. There were 0 counted instances of staff or peer injuries. There was a reduction in staff stress. There was absolutely no turnover. And then a considerable financial savings within the agency after the implementation of this MBPBS program. So, you know, especially compared to other programs that they were using, and they're not having to go through the hiring process over and over again. If they can retain their staff, they're saving money. So, you know, Singh and colleagues here really established results in a very applicable way. That mindfulness-based interventions, that they can be valuable in this line of work and that they can produce positive changes in caregivers' lives. And again, in turn, helping those that they are caring for. You know, seeing the just immense positive outcomes that mindfulness-based practices can have on these individuals and their organizations as a whole. I encourage continued research in this area. And for anyone listening that works with this population or that's just interested in your day-to-day, I encourage you to adopt some mindfulness practices in just your day-to-day life, even if that's just taking a minute. I don't know if anyone has an Apple Watch, it'll ding and tell you to take a minute of deep breathing, just taking any moment you can throughout the day to really focus on the present moment, your senses in the moment, what is happening. You're not worried about the future or the past. But I encourage you to adopt some of those practices and see if you reap any benefits from that.
Okay, thank you, Alyssa. Oh, trying to get my video to come back on. Alyssa, remind me, with the 2014 Singh study, did they talk about how long those benefits lasted, the financial benefits and the things that they saw?
I don't believe so. I actually think that might have been one of the limitations.
Limitations. That's
Yeah.
yeah. So that's one of the things that I kind of wanted to mention here. We have a lot of what I still consider preliminary data regarding this. We need some long-term data to really see how this impact on caregivers within the home and within agencies and residential facilities and things like that, how long it's lasting. Because we have some studies, like you mentioned, that are going a year, almost up to a year long, but we really don't have a ton of information about follow-up. Like, do we need these little jumpstart moments of reminding you to do mindfulness and those types of things? So I'm curious to see where the field goes as we move into that more. But we wanted to take, I know we're supposed to kind of end in about 10 minutes here is my understanding. So we wanted to take the last 10 minutes to really share as a group, and feel free to turn your camera on and share, or just share through audio or even in the chat box if you're interested. We just wanted to kind of hear from you guys some mindfulness strategies that have worked. We figured we'd talk about those for a little bit, and then if you have questions as well, we can go into that. But we would love to hear from you guys in terms of what strategies you've been using or have seen clients used or recommended for clients to use regarding mindfulness. I'm scrolling through to see if anybody's commenting yet. This is where doing an online training is a little trickier. So let me ask another question. Have you used mindfulness in your practice with clients, in your own life, things like that? How many of you have used mindfulness in the past, just personally in some way, shape, or form? You could throw a yes or a no into the chat box. Yes if you have, no if you're pretty new to mindfulness.
No, I haven't, but I actually work and complete my internship at a 24-hour residential facility working with the IDD population. So I'm interested to hear from other people about how that works for them, because I know that there are times where we have to utilize physical restraints, and that would be great to hear some techniques that anyone else has.
Thank you. Yeah, so in terms of sharing techniques, I'm seeing some people saying yes. There's a mindfulness breathing exercise, takes about 7 minutes initially. You do it for 30 days, becomes part of your muscle memory. Turning your palms upward relaxes your body. Utilizing breathing techniques, the 4-7-8 breathing technique. Those are the ones I'm seeing right now. So we have some people who use it, seem to be using it personally, maybe not having used it with clients or suggested for caregivers and things like that as of yet. But Alyssa, I was going to go ahead and let you kind of take that question in terms of what you've seen with the research and what you've seen personally in your job, in your practice, what's worked for some mindfulness techniques and strategies for your colleagues.
Mm-hmm. So something, and this is very specific to my job. And so in my job, we do sometimes have to use physical restraints, things of that nature. And that's something when I started working at the hospital that I work in, I was completely, taken back by it, something I was not used to before. So that was one of my main missions, was to let's decrease the rates of those restraints and seclusions. Let's get that, more under control. And something that we do at my work, and it's kind of, we developed it out of a mindful, mindset really. And it's called a staff timeout. So what we'll do is, when a situation is escalating, we certainly want staff that are able to kind of help de-escalate that situation. But with the rest of the staff, what they're instructed to do is to kind of, all of them, as many as there are, kind of congregate in an area where they can kind of take some deep breaths. We're taking a staff timeout. Let's talk amongst one another and plan for what we're going to do versus just reacting in the moment. So having about, and sometimes there's not even a major discussion that needs to happen. A lot of my staff have come back and reported like just us stepping away and breathing was enough for us to realize that, oh, the situation is not as intense as we are making it seem. Maybe we are overreacting. So even just taking those couple minutes to kind of literally step away from the situation, as long as it's safe too, of course. Take those breaths, kind of, talk amongst one another, because again, you're bringing that awareness to the situation. There's more control. A lot of times if we are overreacting, or we are being reactive to a situation that's already very reactive and escalated, we're just, kind of adding fuel to the fire. So if we can just kind of step away, I see, people are, those breathing exercises, literally taking a minute to just, 60 seconds is not that long. Taking a minute to just breathe, that can sometimes be enough to, bring you back down and grounded with the situation at hand, and can allow you to kind of, I don't want to say take control of the situation, but have more control over your emotional response in the situation.
Yeah, absolutely, Alyssa. And another thing I would add to that, I'm hoping a lot of you are familiar with Brene Brown and her work, and she talks about how anxiety is actually contagious. And so if we're getting anxious about what's happening with a client, then our response can become contagious in a negative or a positive way, because we can actually then go, wait a minute, and become the calming factor within that situation. And sometimes holds are still necessary for client safety, for caregiver safety, for various things like that. It does happen where that's still a need, but how we present ourselves within that time period can either escalate or de-escalate a situation. So our goal is to always go in mindfully going, okay, I'm going to be a calming presence, even though this is a challenging situation, instead of being a contributor to the escalating anxiety. And I call it getting ramped up. When people get ramped up around something that's happening, they kind of start to feed into each other. So that's something we want to be careful about. And I'm seeing some good things coming in here in the chat box. So I hope you guys are paying attention. There's some links in there as well that people are sharing oh no, that's a link to this session for a survey. Thanks, guys. So anyway, but I'm seeing things where people are talking about mirror neurons and calming down. And yeah, exactly. That's where we want that contagion to be the calming effect, as opposed to the ramped up, escalated anxiety effect when we're engaging with our clients, whether we're caregivers engaging with our own children or clients in a clinical situation. But with the last few minutes we have, did anyone have any questions that they wanted to get some clarity on? Always want to give everybody a minute to type. There we go. What are some mindfulness strategies and a few interventions that are helpful? So some of the ones that we talked about are, the breathing mindfulness strategies, really being present during those moments. The ones that Alyssa mentioned here, I'll go back. So this little graphic comes from mindfulness-based stress reduction programs and some of the mindfulness-based positive behavior supports. So I would highly recommend, if you just kind of Google some of those strategies, those articles have very specific step-by-step procedures that they go through when implementing those specifically. So those are some really good resources that have the research behind them that I would look at specifically. And let's see, any studies yet showing difference between mindfulness and anything else that's done consistently? That is a big question. Alyssa, I'm trying to think if I can think of anything off the top of my head.
So typically when you're getting into the research about, the MBSR and BPVS, there's a lot of components that are going into it. So a lot of times in their limitations to the study or implications for future research, they will mention, doing a component analysis to kind of pick that apart, tease it apart to say which part was the most effective in the intervention.
Yeah. And Kathy, I think that's, I kind of am guessing that's where you're going with your question. Like, is it mindfulness or is it consistency? I wonder that sometimes about a lot of our interventions. Is it that we're just being more purposeful too, right? Mm-hmm. So I think those component analyses are key, but I think that's why for me, I need to see the long-term data. I think mindfulness does amazing things, but is it maintaining over time? Is it generalizing to other areas, or does it constantly have to be revisited? Like I said, like jumpstarting it. And I have not come across really great research where we know the answer to that yet, and we know which specific components. In my experience, MBSR and MBPBS they're kind of like a conglomeration. They took a lot of pieces of mindfulness that people use and went, aha, let's lump these together and we're going to call it this. So sometimes that's what we see, is they just repackage it a little bit. So it's still a really emerging area to a degree with individuals who are caregivers for those with disabilities. So I think we need more information on that yet. We just don't have a lot of consistent research on the question you asked. So it's a great question. If anybody wants to delve into that research, I say go for it. Anyway, all right. Thank you everyone for coming today. We really, really appreciate you taking the time to spend with us on this afternoon. And apparently there's a link to the survey, so I'm sure they would appreciate that as well. Thank you so much, everyone. Have a fantastic day.
Thank you.
Thanks, Alyssa.